and welcome to Round Robin. I'm your host, Robin McCormick with the City of Hampton. And today we are going to tell you about an exciting new program at Sentara Careplex Hospital. And I'm going to introduce you to a neurosurgeon, Dr. Tina Rodrigue. Welcome.
Hi, thanks for having me.
You know, this is a really exciting thing to talk about, a new kind of center of excellence. Sentara Careplex is already so well known for the orthopedics and surgery there. Good records, nationally recognized for the heart attack treatment and a whole host of things, obviously. But you are building, with support, of course, this new neuro. So tell me what that means. Like, what kind of conditions do you treat?
Well, I'm a general neurosurgeon, so I treat all kinds of conditions that have to do with the brain and spinal cord.
See, I just think brain. I forget the spinal cord is, part of that.
Yes, and actually, orthopedics has a huge presence in spine as well. So I think, we do have some, right, we do have a combined role in that. But we take care of spinal cord problems, spinal degenerative problems, and any brain conditions that has to do with brain tumors, pituitary tumors, stroke, hemorrhage, things like that. So we take care of all of it.
I hadn't really thought about this as being, kind of a big or growing area, but as, baby boomers like me age, not only do we need the ortho part of the Careplex Hospital, but stroke is a huge issue, and degenerative spine and back problems and all that sort of thing.
Absolutely. I mean, those are two illnesses or problems of aging, and, as the population ages, we're going to run into more and more of that, absolutely. So, we take care of a lot of people in neurosurgery.
So how long have you been with Careplex? I know you were at Sentara Norfolk General for a while.
Right, so I've only been at Careplex for a little over a month now. I was working at Norfolk General Hospital for the last 12 years.
Okay.
And then I was at Portsmouth Naval Hospital for 3 years before that. So I've been in the community for a long time. But my husband and I decided to relocate up to the peninsula, and this was a fantastic opportunity, so I had to take it.
That's wonderful. And Careplex was sort of able to lure you away by asking you to help build the facility and the center and all that kind of stuff.
Yes, in a way, I've always been sort of the junior doctor coming on to an established program. The opportunity to build a program that is, I think I can try to incorporate what I see as the best of the programs I've been in and eliminate what I don't like of those programs. I'm very excited about doing that.
So, to be honest, people who have lived here a very, very long time, like since when Sentara Hospital was over on Victoria Boulevard, it wasn't this new modern facility
I've
that
heard
we have
all
now,
about it, yes.
Tend not to think of that hospital as a center of excellence and a place with really good patient outcomes. And I hadn't realized that because I've been inside, I've talked to people. It is, if people haven't been there, an amazing facility.
I'm actually really impressed. Like I said, I've been at the Mecca for years now, and I thought I was coming to kind of a smaller community hospital with not very much, but I've been very impressed with the technology. I've been impressed with the nursing staff. I've been impressed with the people that I work with every day. They are committed not only to making Careplex the best hospital on the peninsula, but to every patient that comes in the door. I mean, I've been very impressed with the whole place. Like, I'm happy I made this move.
That is wonderful.
Yeah.
So did you order, there are cool new equipment? Because you're using, tell me how you do it. Like, there's laser and scopes and all the cool stuff that you see on TV, right?
Yeah, it's just like Grey's Anatomy.
Is it? That's
no,
what I was going to bring
not.
up. but some of the equipment.
But yes, we have fantastic equipment.
Yeah.
And Careplex has invested in purchasing some new equipment that's the same stuff we have at Norfolk General, the same stuff you'll see at a lot of the quaternary centers in the United States. So there are new navigation systems.
What does that mean?
A navigation system allows me as the surgeon to know exactly where I am in the brain or the spine in three-dimensional space. Because the brain is a ball, right? And so if I'm trying to operate right here, but all I can see is the surface, you're guessing without navigation. With navigation, I can pinpoint where I want to go, and there's no, external damage. And it's the same with spinal surgeries. A lot of the spinal techniques we now are doing, they're complicated. And so having navigation is an important technology for us to use.
So in your career, you have probably seen huge advances in this area. Like, what was it like when you were starting versus now?
So the navigation component of it is a huge change. When I was first starting, it was pretty new, and it didn't work that
you're
well.
not that old. Yeah.
And it didn't. I'm not that old, but I look back. I finished my training 22 years ago. I mean, I'm like, wow, oh my God. So it's changed a lot, and even things like the minimal invasive types of surgeries that we're doing for both spine and brain, that wasn't there 20 years ago. I remember learning how to do pituitary tumors by myself with a microscope and a headlight. Nowadays, that's all gone. I have an ENT surgeon who can open for me using this beautiful endoscope. There's almost no trauma to the internal areas. The lighting is better, the visualization is better. I mean, that technology is impressive. And then just the ability to take out brain tumors through a small hole rather than a big cranie is amazing. So we have a lot of technology now that we didn't have then.
And so that means a tremendous gain for patient outcomes.
I think so.
And less recovery time and a whole host of other wonderful things for us, the
Yes,
patients.
yes. And then the other thing that I'm going to say about neurosurgery is that some of the greatest advances are actually how do we avoid surgery in many of these people. So for instance, when I was training, the only good way to treat an aneurysm was to put a clip on it with a big open brain operation. But now, honestly, probably 90% of aneurysms get treated with an angiogram, which is just a small procedure with an arterial stick with a needle. That's amazing.
So that's things like aneurysms. Mm-hmm. What are treatments for stroke? Because I think stroke outcomes have really improved.
Yes, and a lot of the stroke technologies also are non-surgical. They have to do with angiograms, the same type of technology.
See, that sounds surgical to me.
I know.
I know you create a distinction, but I don't understand all that.
Well,
a procedure is a procedure.
Yeah, as a surgeon, I make a cut, I make an incision with a knife. An angiogram, they put a needle in, and they can work wires in. It's just like putting stents in a heart. They can put stents in the brain now for strokes.
Isn't that amazing?
And they couldn't do that 20 years ago. It's amazing. Now, that's not a technology I personally perform.
But it's all, and that's what's, I think, so wonderful about Sentara is that it is a system of care. Mm-hmm. And you can sort of tag team doctors. So you could do the diagnosis, but someone else could do the surgery, or the follow-up might involve. So there's all that backup and support.
Yeah, I mean, if there's something that I don't feel like we can handle at Careplex, I have plenty of backup. I have backup at Norfolk General. Absolutely. And so there's always more expertise in this system. It's great.
So what do you foresee in terms of the program in the neurosciences that you're building at the Careplex Hospital?
I think our goal is to provide sort of a comprehensive general neurosurgery program and general neurology program. We'd like to expand our stroke services to become a comprehensive stroke center, which does include this angiogram type treatment I was talking about. Mm-hmm. So that's the goal.
But that's for the clot strokes, right? There's still the
It can be clot strokes or bleeding strokes or aneurysms. Eventually, we'd like to be able to treat all of it here. Yeah. So honestly, I want to be able to provide almost the same level of service that we provide at Norfolk General.
That is wonderful. So, okay, how can a somewhat smaller, more of a community hospital, not that regional center, how can Careplex and Sentara make that commitment here?
I think Sentara is committed to the communities that they work in. And I think they understand that people on the peninsula don't want to go across the water for their care. So I think they want to provide the right services in the right location, and to not commit to treating people who have neurological and neurosurgical diseases here on the peninsula by creating something here, they're not going to serve this community because otherwise no one's going to go across the water. They're going to go elsewhere. They don't want that to happen. They want people to get their care with Sentara. And so it means providing those services where those people live. And I think Sentara means it when they're trying to build that.
That's exciting. It's very exciting because they have that. And I forgot to say they added maternity and care now, and they're just really growing. And at least from my perspective, they're doing it sort of deliberately and not growing everything at once, but growing something, getting it to where it needs to be, and then adding and thinking their way through that growth.
I agree. I'm not an administrative person. I'm just a doc. But I have watched them deliberately build programs on the South Side. And that's exactly what they do. They pick a strategy, they pick a program that they want to build, and they commit resources to it, and they make it happen. And when I heard they were going to commit resources like that here to Careplex, I said, I want to come in on the ground floor because I know what they do.
And that's exciting. And then you get to put your stamp on it and your expertise.
Yeah.
So very exciting.
Yeah.
Now, on a personal level, what is it like coming from, the South Side to Hampton?
Well, honestly, it's a different community. It is more cohesive in a way. It's a smaller community. I feel like in a way it's an older community, not older in age, but older in terms of history.
Oh yeah, 400 years is nothing to sneeze at.
Correct. And I think people have pride in that. The South Side is very fragmented. I think they talk about the 7 cities sometimes and how we can't get along on the South Side. Like if we could just regionalize, it would be a more powerful situation. Probably it would. But I've lived in Portsmouth, I've lived in Norfolk, I've lived in Chesapeake. Haven't lived in Virginia Beach, but I will tell you, each one of those communities has its own little clique. I feel like Hampton does too, but that it just, I don't know, it goes back a lot longer. It feels a lot more like a family here in Hampton. And I've really enjoyed the community so far, and I really enjoyed Careplex. The people who work there are proud to work here in Hampton. They're proud to be part of this hospital. And many of them have been here in the system since it was Hampton General.
Right.
So they still talk about it. They're still proud of what it's become. So that's really nice.
Well, that is exciting.
Yeah.
Is there anything you want to add that I haven't asked you about before we close?
No, I don't think so. I think you've covered most of it. I'm excited to be here. I'm excited to build the program. I've been seeing lots of great patients already, and I hope to just keep building this program. We're hoping to bring in another neurosurgeon next year, and so the more that we can bring people in, the more people we'll be able to serve.
Well, I certainly can't ever say I want to be at the point where I need a neurosurgeon.
No, absolutely not.
But it's so comforting to know that you're there and that the program is there and that we don't have to go far to get that first-class treatment.
No, I think you don't. I think we have it here in Hampton.
So thank you. Thank you for choosing Hampton and coming over to build this program. We really are excited.
Thank you. Thank you very much.
All
And
right.
thanks for having me.
And I want to thank you for watching, and please understand all of the growth that's going on there. It's a super modern facility, great physicians and surgeons, and this program you've heard about, you're hearing about it on the ground floor, so we'll watch it grow. Thanks for watching.